Trust Your Revolution show, a show for men and the people who love them. We'll discuss how men can find and embrace the revolution within themselves, where people can find and embrace the revolution within themselves. I am your co-host today with my good friend and my dear brother, Dr. Travis Batts. I've been calling you all kinds of things, Dr. Travis
I know.
Batts. And this is our recurring show, Revolt and Evolve. We hope that you are doing well. Dr. Batts, what's going on with you? How are you? What's good for you? Talk
Great
to
to,
the revolutionaries. Let them know what's good.
great to hear from you, my brother. And again, it's just good to see your face. Now, of course, we've conversed up until this point, but it's something to see your face, to see you smiling, and to engage in this just fun conversation that we have. And I know we've been having some fun and really just seeing summer to a close and deciding, what fall looks like, not only for me, not only for my family, but for you and just curious. This is one of
Yeah.
them curious conversations where I'm optimistic of what we're going to talk about.
Yeah, yeah. You know what? I like that. I like that you dove right in because um I'm not giving up on summer. Like, okay, I'm just letting you know that right now. Like, I'm not giving up on summer. Summer. It's still 90 degrees here. I was at the beach this weekend. At the recording of this episode, I was at the beach both days. I will go to the beach because I've seen my birth color, and I never want to be that color ever, ever, ever. My tan line is like as short as possible, right? So
Mm-mm.
never want to be my birth color. Look, I don't want my Swedish Norwegian roots, you know what I'm saying, to ever show. I want my African side to always, always, always be relevant and at the forefront of who I am.
There you go, my brother. There you go. Always representing
Always.
Wakanda forever.
I was like, power to the people. Look, power to the people. You know, man, that's
Hey,
what's
light
up, man.
skin is back now. Why you tripping? Light skin is back. There you go.
I never understood this. That I never understood it back. Cause like light skin never went anywhere. Like
It did. It did. There was you don't want to admit it. There was a period where it was post El DeBarge is where it kind of went, post El DeBarge, people started, looking at the rainbow,
the
at the
rainbow.
diaspora of colors, and they just kind of moved away. But I think now everyone, it's equally loved, right? We got love for everybody,
Yeah,
but yeah.
exactly. We have to love our people. We want everyone to love on our people, regardless of where you are along the African diaspora of human.
Yes,
We love you. We love you. We love you. Want to be in this world with you. Um,
certainly.
and whatever identity that you have along whatever spectrum that you're on, that you identify, we love you. We want to be here
That's what it's
with you.
about.
Um, let's jump in there for a second because allyship is important to me.
Hmm.
And we'll get back to this fall conversation, but you said something that I think is important to this conversation. And I was actually having a conversation with another person about the show, and I realized that when we first started What's Your Revolution, I was really cognizant about it being a very inclusive show. That we had folks across social economic status about around sexual orientation, around um, the gender perspective,
Hmm.
the gender spectrum. If we want to even go into the gender spectrum, I had people across all gamuts, and I realized that I've gotten away from that. And that is an interesting thing to me as someone who believes in inclusion and inclusiveness and hearing the voices of everyone, because you and I talk about this at length, that everyone has a revolution. Every human has a revolution.
Right.
And so why haven't I been conscious about making sure that everyone's voice is actually heard on this show? So yeah, would love to hear just your thoughts on that. Um, and how do we make sure that we are inclusive in these conversations around what revolution looks like for us?
No, I mean you bring up a great point in the sense of, and the way I think about it is, and I don't know if you had a guest or if it was a conversation we had where we talked about the role of articulating, expanding, and knowing what your circle is. meaning the
Hmm.
circle is the people or the groups that you have around you. And through our interactions, through where we go, and through largely what we do, our circle is built, whether we know it or not.
Hmm.
And I think, and you think it was a separation from this broadening that circle, but what I think you've done now, and it's in because I'm a super fan as well, but I think you're just shoring up areas that you see need, right?
Mm.
Meaning the fact that you've brought a guest back that really helped you to, kind of reframe the conversation, and about, kind of how you show up for the world and what you do. Because when you look at, and again, I'm going to use softer language. When you look at how we are rewriting history, not that I want to make this a political conversation, we need people to understand advocacy at the personal level is important.
Yes, that's true.
When we look at, kind of branding, one that, kind of how do you brand yourself, so I think it is reaching back and saying, what does the community need? And when I say the community, I'm talking about the global community, because
Hmm.
the conversations we have are not exclusive to African Americans. I mean, many of my friends who listen to the show don't look like me and
Hmm.
gain just as much from it. And I
Yes,
think
that is true.
that is part of the inclusivity, right? Where other people that don't share necessarily the same birth experience or the same growing up experience understand that there's a certain synergy that exists when you elevate your thought and you evolve and
Yeah,
you
yeah,
revolt. And I
yeah,
think that's the beauty of what you're doing. And even though it seems like, well, man, this is the same, but it's a different voice. It is identifying different voices through the lens of some of the same people. So
yeah.
and that's where I'm not disagreeing with your observation, but I'm just seeing it from a different perspective to say, nah, we still popping out, new ideas and new concepts that may come from, that same ledge, but at the same time, it's resonating with different folks.
Yeah, yeah, and I hear that, and I definitely hear that, and I want to make sure that anyone who listens to the show feels like, hey, Charles and Travis are with me and talking with me or talking to me, and that I can find resignation with anything, the issues, the topics, the ability to revolt and evolve, the ability to find your midwives, and in the midst of chaos when you need that. Even if this show in itself is a midwife, as it can be, that the people that come on the show can be midwives, because hopefully it's opening thought, hopefully it's opening interaction, hopefully it's opening community, as we talk about so much here on the show, is that in itself is so important, that community, what we're doing with community, is grounding us for longevity. And speak to that,
Right.
because you're the person, right, who understands not only that cardiac health, right, is that the right term, cardiac health?
Yeah, that's the right
Yeah, yeah,
term.
yeah, yeah,
You
cardiac
put you
cardiac
put
health is
cardiac
so.
in front of anything, it's always going to be the right term.
I got you. All right, so cardiac health is so important, but you as much know that the medicinal aspects of community and how that
Right.
can lead to greater heart health and greater longevity. Talk about that. Be Dr. Bats.
So okay, you want Dr. Beth,
I
but
want
no,
Dr. Bats. That's right, because right, Revolutionaries. He got an acronym. He got a story.
I'm
He got
saving
something.
that. That acronym is coming later. That acronym, but
Yeah.
I told you, and it was inspired by a conversation we had. Was basically, and this isn't one of the tenets, but it is kind of revolving where you are and seeing what you have and reaching the people you can. And so when I think
Mhm.
about community, and I'm only now this is our community, right? But
Right.
you could transpose this to any community. I think about the barbershop. And
Yes.
so about a
Yes.
couple weeks ago, we had haircuts and heartbeats. And it literally was a back. I know. I couldn't think of a cool acronym, but it was literally my barber saying, "Hey, man, we got to do something." I had a customer come in. His blood pressure was this over this. He went to his doctor.
Mhm.
His doctor was like, "That might be your normal." By no means is that your normal. The blood pressure was his blood pressure. Had he have gone to the emergency department, he would have gotten admitted for a condition called hypertensive urgency, meaning you
Mm.
have not had end organ damage yet, but you are knocking on the door. And so that conversation, as we were having that conversation, it kind of spurred on a different conversation
Hmm.
where one of his other barbers came in and talked about, their battle with weight loss and how they had
Hmm.
started a new agent and the doctor didn't explain to them the side effects. And I'm listening to all these things and I'm like, well, how? And so it just created this conversation when now we had a group of troops. We had a team that was mobilized with a common goal to enhance our awareness, to improve health awareness towards cardiovascular disease, the number one killer of Black, white, men, women, all across the world. And the event really kind of was juxtaposed against this idea of, back to school. But then 2 weeks prior to that, there was a young man that collapsed suddenly on the football field.
Yeah,
Right.
yeah,
And when
yeah,
you think about sudden cardiac arrest, that's something that's near and dear to my heart. I mean, I was a former Division I athlete. My daughter was a Division I athlete. And, by the grace of God, we didn't have any issues. But when I look at the numbers and I see that African American males are at the highest risk for sudden cardiac arrest,
yeah,
when I look and see that basketball is the risk that, is the sport that, kind of portends that risk long term, and to know that there are places that don't have clear action plans or folks don't know how to
mhm,
respond.
yeah,
Again, it's just creating that community, providing that engagement, and really shaking things up from a standpoint of you have to advocate, you have to align,
mhm,
you have to have that allyship, not only for yourself, but also for your community. And I think that when you take those steps to do that, it might seem big, it might seem challenging, but once you get advocates, once you get teammates, and again, one of the tenets, your revolution can't be just for you, right?
mhm.
Right. And so as you take that step forward and bring folks along, as you did me, right, as you brought me along on this ride, and I hope to get to hang out a lot longer, it,
Oh
it
yeah, oh
showed
yeah,
me so many spaces and so many places where individuals such as ourselves are needed, not to run the ship, maybe to row, maybe to help steer the rudder, maybe to set the GPS. But at any point, having us involved in creating that community is what's going to help move all of us forward. Not just
yeah,
Black folks, white folks, but just everyone helping us to move forward to really reach that revolution that we need.
yeah. Man, look at you. Look at you. Right. That 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 is correct. And that is that all of this. And this is the first thing I'm gonna say that I don't know what portend means. So I will go back. I don't know what that means. So that
You are
would be my.
tripping.
I know that would be my Jeopardy. That would be my Jeopardy question. Alex, I will portend for 1,000. Um, thank you for that. Thank you for that.
You got jokes all the
Yeah,
time.
all the time. But I think that's great. I want to bring it back where it is so interesting because I want you to dive more into hypertensive urgency because the revolutionaries in my ear um, is that what does that look like? What is a hypertensive emergency? I take blood pressure medication every day, and
Hmm.
my blood pressure today was actually a little alarming. It was 130 over 90, and I'm like, I take my blood pressure. I was like, did I take my meds today,
Hmm.
or did I take my MEDSS today? Well, no, but I did. I was like, did I take my MEDS meds today? And I
Right.
was like, I had to think about it. Did I take the? I know I took the vitamin D. I know I took the thiamine, but I was like, did I take my blood pressure med? What is
Right.
a hypertensive urgency?
See, and we haven't had one of these conversations. I've
No,
I've moved away from, hey, let me talk, but this is
this
my
is
space. I love this
yeah,
space.
this is
So
your space.
hypertension, and we often hear it in our community or in all communities as the silent killer, right? You don't
Mhm.
feel your blood pressure go up. Now sometimes you can get a headache, you can feel a little sluggish, you can feel a little fatigue, but for the most part, and there's a family member that texted me her blood pressure readings, and it was, you ready for this, 226 over 130. Right. And she said, you think I should go into the doctor? Because I don't really feel bad. And the short answer, of course, was yes, go right now. Do not pass
Right
go.
now,
Do not
run,
collect $200. Of
run,
course, she
just
goes, they admit
run.
her, they tell her how serious it is. And she calls, she's like, but I didn't feel bad. And that's the scary thing about hypertension, right? It's one of those things that kind of smolders until you have damage. So there are
Mhm.
different stages, right? So you can have pre hypertension, right? It's where you're close, but you're not there yet. You can have stage one, which means you've just reached that threshold of less than 130 for your systolic or top number and less than 80 for that bottom number. You can have stage two, And again, those numbers continue. Now, once you get to a certain point, typically we characterize this when that top number, that systolic number gets above, let's say 180, and that bottom number is above 100, you move into a space where you have hypertensive urgency,
Mm,
meaning that there should be some urgency. Now, again, the definition, you can Google it and all that. But for me, when I talk to my patients, when your values get that high, there should be a level of urgency that you seek care. Right now,
yeah.
does that
Mm,
mean they're going to admit you? Not necessarily for hypertensive urgency, but the downside is you don't want to shift into hypertensive emergency. What
mm,
hypertensive emergency is, it means that your blood pressure is so high that it's starting to damage organs. Near and
mm,
dear to my heart, excuse the pun, is the heart. The heart gives
yeah.
off an enzyme when it's damaged, right? It's called troponin. It's an enzyme that's very specific to the heart. And if the heart is pushing against a high blood pressure, it'll leak troponin. The kidney sometimes will tell you, hey, we can't deal with this blood pressure. And so it starts to affect the nephrons. These are the
Yeah.
small
Mm,
areas in the kidney that
yeah.
get destroyed because of too much pressure. So you'll see an elevation in basically how much protein you release in the urine. And there's a host of other factors that when we see this evidence of end organ damage, that we know we have to bring that blood pressure down fairly quickly in an emergency room setting. And I know
Yeah.
hopefully we didn't go too far off the tracks,
No, no,
but
no, no. This is good. This is
yeah,
good.
no.
And
So that was my thing is, and I'll say something that my pastor always says and I think that we are blessed to be a blessing.
mm,
And it is interesting, and I'll give another discussion about a family member who um called me with a concern. And when I listened to the case, and sure, it sounded like a musculoskeletal, meaning something was going on, but he had other features that might place him at higher risk. And so I said, well, I don't want to give you a cheat code, but sometimes it helps when the patient knows what trigger words to say to the provider to let them know what they're concerned about. And he's like, well, what do you
yeah.
mean? I said, well, if you go in and say, yeah, my chest kind of hurts. Okay, they'll listen, have a seat, wait 4 hours. If you go in, now folks don't do this, but if you're having chest pain, don't be subtle, right? This ain't the time to be cute and be polite. Go up there. I'm gonna tell you like I tell, but act a fool. Act a fool and say, hey, I need help. This is what's going on. And so what I told him was let them know that you're having this symptom. This is the condition you're concerned about. If you go in and say that, they know you went to Dr. Google, but you have to lead them there, understanding that
Yeah.
this is what your
Yeah.
concern is. And
Right.
he went in and he said, well, they told me when he called a few days ago, hey, it might be 2, 3, 4 weeks before we can get you in. He went in, and again, we didn't and told him what to some degree what his concerns were. I think that was yesterday. He got seen today. He's scheduled next week to get, and not to say that healthcare should be that way, but it's tough. People have a ton of things going on, and especially when it's hard to build that relationship. And it's not
Yeah.
just in healthcare, right? It's just like when I look back, and I forget when it was when you were talking to students about kind of where they see themselves and what they want to be, but they couldn't articulate, even though they knew, like in their head, they could see it, but they just couldn't articulate it. And sometimes
Mm,
it's our job to be that, revolutionary translator, right? Where we help pull out what's in there and help them articulate truly what they need and where they are.
I think that's called a midwife.
There you go.
There we go. I think that's called a midwife. I think, you used the word advocacy a couple of times in this conversation. And, really, really knowing what medical advocacy actually looks like. And I remember, when I took over advocacy for my dad, and I remember taking him to the eye doctor one time, and the eye doctor, eye doctor, being one of our lighter family, right?
Hmm.
One of our lighter family, and he just started talking. He thought that he was talking over my head. He was all of these terms, the ocular, all these different things.
Hmm.
And I remember throwing something back to him, like I'm subtly letting you know that you're not the only doctor in the room, right? And and then he was like, you seem to know so much about the eye and what's going on. Like, are you a doctor? I was like, I might play one on TV, but I'm a PhD. So, um, But yeah, and then all of a sudden it was like his tone changed so
Right.
dramatically. He was like, "Oh my God, I love this. I love being able to talk with people." And so we
Hmm.
had a great conversation. I was like, "Okay, well, what are the ramifications of this medication on my dad's eye? How will this impact his long-term height, long-term sight? What is the ocular damage, the macular damage that may happen?" And he was just like, so advocacy, and my father was fortunate that, he had someone who, loved to learn. And I think advocacy for anyone comes particularly from a medicinal perspective, is that we have to learn what's going on with our own bodies and our families' bodies so we can actually, as you said, speak up when the time comes. Because at the end of the day, both you and I know, um, you got 5 to 7 minutes in the office with a doctor.
Right.
You don't get 30 minutes anymore. You get 5 to 7 minutes to say what you need to do. They're gonna be in there, have a conversation, quick conversation. They're gonna write a script or send you to the next person. Um, our healthcare system is predicated on people advocating for themselves, really understanding what they need and yelling, 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 this is what I need. That's the revolution right now, I think, in healthcare, is patient advocacy and understanding, being medically literate, and particularly for folks that look like you and me, being
Right.
medically literate as much as we can to actually say, I don't know if I agree with that, or you know what, this medicine is actually giving me side effects that I think are harmful for me. Because as we talk about this, Doc, you and I both know it is weighing the benefits versus the consequences when, sometimes with certain medications, like you're
Right.
going to get relief of this, but there may be some side effects. And so I'm going to prescribe this because the benefits may outweigh the consequences, and we just have to deal with it.
Hmm. Yeah, no, and I mean, that interaction that you talked about, most physicians that I know want to engage with the patient,
Yeah. Hmm.
right? They want to, but to engage as a physician, and I tell my patients, in this, and now granted, I'm blessed. My patients, and I don't care where my patients are the best in the country, period, best in the world. Because what they'll do is they'll do a little research. They'll let me know before they come what they did research on. And then we focus our conversation not around me directing and telling them what to do. It's me helping them. I say at the end of the day, I just make recommendations. You're
Yes.
my boss in this setting. And I think a lot
Hmm.
of physicians, yeah, the patients are, at the end of the
Yeah.
day, think about it. If the patients don't show up, if the customers don't show up to any business, what do you call that business?
Out of business.
Out of that's what you call it, right?
Out
So
of
I
business.
so I'm happy and engaged anytime they come. Now, granted, we have many of my patients have been my patients for almost 20 years. So the relationship is
Mhm.
different. I mean, they know my kids, they know this, they know that. But most times when they come prepared. But that's because we've worked together to learn how to understand what your medicines are, how to look at the last name of your medicine to truly know what class it is, and to know that classes of medicines have effect, to know
Mm.
that certain diagnostic studies have benefits, certain diagnostic studies are limited. We talk about, when I say the test is not as sensitive as
Mm.
one test, the test is more specific, right? My patients, some of them know what that is. Now, this isn't a master class in understanding medical lingo. It's a master class in understanding how to articulate what's going on in your body,
Yeah.
right? and
Yeah.
and and by doing so, it empowers the patient to know, oh, my doctor increased this by this medicine, and I know that this medicine can cause swelling. Okay, over the next 2 weeks I need to be looking for this. Doc, yep, check for that, make sure, let me know if that happens, right? And it's an ongoing engagement. It's almost, we won't talk about mentorship, yeah, but it's almost like that. And that's where some of the idea about that process came. And in speaking to just that interaction that you had, and you let me know once, and I'm not going to say once he felt like you were engaged and you invested in him, how much more was the physician invested in the care?
Oh, he
How
was
much?
he was yeah, he was completely invested in the care. Like,
Exactly.
yeah, and I almost felt like you can't bullshit me now. Like, you know what I'm saying? And I think that he realized, oh, I can't bullshit them now. And so that was the thing. And the interesting thing now, particularly with my mother's care, um, and I'm advocating here's the thing. I'm advocating for her own care through to her. So
Mm,
oftentimes, that's the interesting thing. There's an advocacy that goes between patient, family and doctor. But I also think that there's an advocacy between family to family.
right.
And, getting my mother to go to see a gerontologist has been like literally pulling teeth. My mother, she was like,
Mm,
I'm not going to go. I'm not going to go. And I
mm,
understand that there's probably a little bit of PTSD because she watched what
right.
going to the gerontologist with my father. But here's the thing, going to the gerontologist prolonged my father's life. And the interesting thing, and let's just put this out there. If you are dealing with an aging parent and you are the caregiver for an aging parent and you've never heard of a gerontologist, right? Run, run, run your family member. If they are above
Hmm.
65 or 70, run them to a gerontologist. I understand that when I was growing up, nobody wanted to take gerontol because it was the vitamin for older folks. But okay, whatever. Um, but the thing about it is, go to see a gerontologist because they are specialized in treating people as they age. My father was taking 21 pills a day
Hmm.
before he went to the gerontologist. Some of those meds he just didn't need to be on anymore. So he went from 21 to 10 by going to see the
That's
gerontologist.
huge.
21 to 10, right? And one of them, he was on a sedative. He was on a sedative for something that was supposedly controlling his blood pressure. And I remember going to the doctor. I think I was like, "Why is he on this?" And the gerontologist was like, "I don't know, but we're taking him off." But here's the thing: we had to wean him off the sedative,
Hmm.
and understanding that. And so, run as fast as you can. If you're caregiving for a parent, or you're going to be caregiving for a parent, move them into a gerontologist care because they are trained to see an aging population of folks. And oftentimes PCPs will prescribe certain things and folks will like, well, this is what my doctor prescribed and I've been taking it for a long.
Right.
They've never taken them off a pill that they
Hmm.
probably don't need. And so that advocacy there is so important. So again, I move this back to this conversation where we need to have advocacy family to family to make sure that our folks have the longevity. And that's a part of community, right? Because sometimes, Doc, as you know, I can't get my mom to move, but her girlfriend can, right? You know, you know,
Definitely.
right. Hey, Bertha, we need you to go. Or one of my friends, my corporal, I need you to go. Like, will
Hmm.
you do this? Because it's going to help you live a more longer and fruitful and more cognitively efficient life. I'll stop there.
No, I mean you make a good point, and the other piece about advocacy within families, and this is a topic that I don't think we talk about in the medical space, but it's probably one of the single most important, right? Because all right, so as a cardiologist, I see people typically once they have cardiac disease. Makes sense, right? But what if we knew that every member of your family above the age of X had some condition that led to cardiac disease? Why not we talk to you 10 years prior to you having it, 20 years prior to you having it? So the role of sharing information, and in our community, we don't tell nobody business. We don't spill the tea, as they say. But the importance of the family history is becoming more and more apparent. And when I talk to patients and they're seeing me, and then they think about, oh, I did have an aunt that had this valve disease, or oh, I do have a cousin that has, and then we're pushing it together. And had we only have known, or had they have shared that information, we probably could have intervened before it got to a place where we don't have those options. So, and when individuals think about gerontology, and you hit one of the big areas that a gerontologist is expertly equipped to handle, and that's polypharmacy. Poly meaning too many, pharmacy being medicines. And it's one of
Mhm,
those things where sometimes you just accumulate medicines. You just pick
mhm,
them up for this, for that. Oh, I took this one for swelling, I took this for sciatica, and before you know it, you have medicines that are interacting, medicines that are
mhm.
interfering with how you process food, medicines that interfere with how you absorb certain nutrients. And it was, again, another patient I saw today, didn't want to get on any of the medicines I took, but I was prescribing her. But then she pulls out this list, and I lie to you not, the list about like this long
Yay,
with
yay long.
and it had milk this, had every herbal. I said, well, ma'am, you're on like 30. So, oh yeah, I said, but you won't take, I said, never mind. You're my, and so I did work with her and we talked about it, and we'll see. I'm seeing her again in another probably 3 months, but she said she wants to talk to her primary because he didn't have. I said, no problem. I said, this is a group thing, but ultimately
Yeah.
sharing information, having those discussions, reducing polypharmacy, ensuring that, from a falls perspective, right? That's one of the biggest things. We know that, as our, family members mature, a hip fracture is associated with increased morbidity and mortality,
Yep.
right?
Yeah.
We know that,
Yeah.
right? So we got to make sure that the home, if they're living with you and you got rugs that aren't down, if you haven't done what's called a home safety eval, right? That's something that they'll come out, evaluate your home for potential safety risk. And I can tell you that they're, the
Yeah.
parents or those individuals, they're going to be reluctant, but you are going to have the assurance of knowing that you've done everything to keep them safe in the home, and
Yeah.
made some recommendations and upgrades to make, again, it a bit more pleasant for them while they're there. And then the final, couple things are making sure that if there are resources in your community, that in many cases are free, right? They are oftentimes subsidized by, the government, to have a community center where there is crafts, where there might be exercise classes, where there might even be meals where, your family member can stay engaged and can stay
Yeah.
encouraged. So for many of my patients, I just have a sheet. I say, hey, look, I need you to exercise. I need you to work on mindfulness. I need you to work on your diet, and I need you to stay socially engaged. Well, Dr. Bass, I don't know how I can do that. Great. I'm glad you asked. Here's a sheet where you can
Here's
get all these things done that's
here's a
free.
one pager.
One page. It's all you need. Well, how do? Or and they got transportation there too, right? So, and again, I'm blessed to live in a city that values that aspect. But I'm sure, we're not unicorns. I'm sure there are other pockets of that around the community. It's just a lot of times we don't know about it,
Yeah.
right? And so search those things out. It certainly will enhance the interaction, their experience, and overall improve their longevity. As you partner with them in their health.
When we think about advocacy, and let's workshop this for a second, and revolutionaries, um, you can help me out too, because you can always send me your thoughts on this as well. Check us out on all of our social media at What's a Revolution. Dr. Batts is he got a couple of them. Dr. Batts TBH 11. What tell the revolutionaries your Instagram, your stuff. We'll put it in the show notes as well. But
Put it in show
we'd
notes.
love to hear from you.
If you
Yeah.
just go to Dr. Travis Batts on Instagram, Dr. Travis Batts. I'm on TikTok now. I only got 2 videos. I'm still working on that content. I got something fun that's gonna drop. If you go to Dr. Travis Batts on YouTube, and of course, if you go to the About That Life podcast,
That's right.
that's where they can find that version of me. That version of me. But
That's
yeah,
right.
no,
And
that's
he's going
me.
to ask you that question. Are you
About that life.
are you about that life? Um, Here's my thing. If we fall back to advocacy, this is what I'm struggling with right now. We know that I'm, you know, on the latter side of this life, right? On the second side of this life. And what I'm wrestling with is, do I need a coach or do I need a mentor? That's the thing. When I say, do I need a professional coach? Because I'm trying to, and this is not the way, this is not the right way to say portend, but I'm trying to figure out how to move to the next level of my life, even at this stage. Like, I'm not cruising. I'm still a striver. I'm not cruising at all. And what does the next level of my life look like? And so, I've been talking to, famous coach to executive black men across the country, Wayne Dawson, who came on you remember Wayne Dawson, he came on and gave such an excellent episode,
Powerful episode.
powerful episode. And so I've been talking with him. And Wayne, thank you for the wonderful proposal. If you want really, really good mentorship and coaching, look at Wayne Dawson, VIP, Transformative VIP Coaching, who's just an amazing human. But I've been talking with him, and I'm wrestling with this conversation with myself, is that, do I need a mentor? Do I need a coach? Or do I need both to move to this next phase of my life? Um, so I would love, because I think you've been thinking about that from this advocate perspective, because a mentor or a coach are both advocates in some way. But so I'm thinking about that. And what are your thoughts? You know, I know that you've got this acronym that you're about to spill out to the world. But
Way
yeah,
to lead
yeah,
into it
help me out here.
subtly.
Help me out here.
No, and for you all, this is why I love my brother. He's smoother than duck butter. Just so smooth. So but the conversation came on the backdrop of a show, and it was that show, the Wayne Dawson show, where it was a discussion about how coaches identify deficiencies and mentors kind of grow. It was in that context that I really started to evaluate my role as a mentor, and whether it's high school students. I have one of my mentees just got to Brown. Shout out! I don't know
Mm,
if I could, but she's at Brown in their BS MD program.
okay.
Shout out Sydney. She was on the Kelly Clarkson show, and I
Oh
look at
wow.
she's brilliant, humble, everything you could say, and I'm gonna shout her out. Great parents, but they essentially said she wants to do what you do in some capacity. Mentor her, and just took their hands off. And I'm like, whoa, okay, what do I do? How do I do this? And we really learned how to identify not so much what her deficiencies were, but just the areas that she was less comfortable in articulating. And I think that was one of our first steps. As the time progressed, she became, almost independent in terms of what she would need from a mentor, meaning she would tell me, hey, would you mind telling me X, right? So she became very self directed. And I can tell you that that is more the exception than the rule. As I
Mm,
continue to look at, kind of these pathways toward mentorship and looked at some of the benefits of that, in a most recent mentorship interaction with the young lady who is brilliant. She's out of the DMV area, and she's looking at everything from Yale to Harvard. But she really didn't know how to vector, like how do I move into that space? How do I do that? And so as I was up one evening, I said, man, how do I encourage her, make this thing work? And so I came up with the acronym for structured mentorship. And if you all are Star Wars fans, and if we had sound effects, I would put it on. But it is called C3PO. All right, C3PO. Right? I know, crazy. So what C3PO is? It is coaching, curriculum, capital. It has to be product driven, and it needs to be ongoing. So that's how you should structure your mentorship. And I'll just give you the C, but C in terms of coaching, just like I do with my athletes, you have to make goals, right? You have to make
mhm.
goals. And I use the SMART acronym with goals, right? They have to be specific, measurable, attainable, realistic, right? And time sensitive. Don't tell me you want to do X over 20 years. I might not be here. I mean, I will, but overall, I need you to have realistic targets that you can hit where in 3 months we're doing this, in 6 months we're doing this. And as we progress and as we get forward, then we raise the bar, right?
Mm,
And
yeah.
so as we work through that process, and if you need targets on how to do it, look back at those shows that we've done here, right? In the What's Your Revolution show. I mean, whether it's executive presence, right? And I got the
Mhm.
book, I don't remember, but it tells you what you should expect and how to comport yourself in a room so that people know you're the person, right? That you have a certain level of confidence, whether it's, understanding how to interact in different spaces that
Yeah.
you're unfamiliar with, right? So it's those type things that I think you can get from, tons of different spaces, but start with, that structure, right? Looking for, and I know your question was, should I get both? I think it's good to find somebody that can do both, but if you don't get
Mm,
the rah rah
mm,
coach that can give you those specific goals, you do need that, right? Because you need to be targeted. But if you need someone for grooming, shaping, you need that too. But if you can find that package in one person or toggle or get them, that's the other thing. Mentorship is not unidirectional, right? When I
that's
talk to a
correct.
mentee, what I tell them is, hey, look, I'm looking to get something from you too. I'm not just investing, 5, 10 hours of my week thinking about how to make you better and do that. You need to be able to tell me. And they said, really? I said, yes. That's what mentorship is. It is a
Yeah.
bi-directional relationship between two individuals who want to see the best in those individuals as they progress.
Yeah. Yeah. It is, and thank you for that. And that's an interesting thing. Can I find somebody who can coach me and serve as a mentor? Because I think coaching, I think the difference between coaching and mentoring is like the mentor has been in spaces that you want to be in and can guide you along that path,
Mm-hmm.
right? I've been the CEO of a company, and so as you move into the CEO role, these are the things that I want you to think about, to really be, uh, cognitively aware of. And this is where you go. This is where I want to point you to find your learnings, right? Where you
Right.
can find other people who are budding CEOs, or CEOs or VCs or whatever it is, whatever you're moving into. That's the mentor, and that mentor on a team, like you're the veteran and the rookies coming in, right? You've got the
Mm-hmm.
coach who's leading the team, but the mentor is that veteran who's played your position. Okay, interesting, the ability for us to talk it out.
Right.
That's the part of community, right? I want to advocate for that. That being able to have a thought partner to talk things out is so important, because oftentimes when you get to the point where you have somebody who can just listen, uh, and Dr. Bax, I didn't ask Dr. Bax for advice, or maybe I did. I did ask you. But in these moments, being able to hear myself talk through this, it's probably the greatest aspect that I've had in a long time. And just you listening, because like I said, the mentor is someone who's been in the role, who's been there and who can give you a little bit of time. And I can call and ask questions like, okay, as I move into this CEO role, I move more into the senior VC role. You've been there, right?
Mm-hmm.
You've been in this position. What should I be looking for? What are the blind spots that you had when you moved into this role? Who should I be navigating with this ship with? How can I, be better at this job? The coach is the one to say, okay, you've moved into this role. I'm here to help elevate your game.
I
And
like
that's the
that.
interesting thing. Yeah, I'm here to elevate your game, to take you to the next level, to give you tools, tips, strategies that are going to make you better. But the mentor is the person that you talk through, like, I'm having this challenge. I know that you've been through it. What did you do? And that's how I think that I'm going to operationalize the two. And so it'll help me think about this more. And I also, it makes me think if I can find somebody who's a coach and a mentor. But I also think at this point in time, maybe the mentor is better as I move into certain positions. Like, okay, you've been here.
Yeah, no, I mean, and I never thought about it that way. I mean, that's pretty cool on multiple levels. I mean, kudos, shout outs, you brilliant. I'm not surprised, but it it allows me to reframe it now, right? In the
Yeah.
sense where when we think about the coach, just like a
Mm,
general coach, he's gonna make the game plan, right? He's going to make the game plan for you, just like you said. But the mentor tells you, hey, this is what you need to get where you're going. And he creates that roadmap. He picks the plays to get you there.
yeah.
So I love that, construct where they're linked, but they are uniquely different. And
Yeah.
you can house both those things in one individual, right?
You
Because
can.
I can tell you the mentorship that I give an early career cardiologist versus the mentorship slash coaching that I give a high school student or a college student are way different, even though they're trying to get to almost a similar place, right? Because they want
Yeah.
elevation in a career path, but how you do it is different in those two spaces.
Yeah.
That is fascinating. That is fascinating.
That is fascinating. And I think that's what, just being able to talk this out, I think that's what I need. And I think revolutionaries, as you're thinking about this, as you're moving to the next level of your life, discerning who the midwife is going to be in this. Is the midwife going to be a mentor? Is the midwife going to be a coach, or is it an amalgamation? Yeah, you got me. Yeah, I've been on this big word kit now. An amalgamation of the two, right? So that you may be able to transcend, my
I
dear
like
brother,
that. There you
right?
go.
Transcend, right? You can transcend your revolution to the next level of your life, knowing that your revolution is not just for you. So,
Not just for you.
um, yeah, this is interesting. I think about, as you said, that mentorship, and you're thinking about coaching, a curriculum, and mentors have, you may have a set thing. You may have a set thing that you talk through. The social capital is the piece that I think that there may be financial capital that comes in there, but there's a social
Right.
capital that comes that you have someone that you can rely on. There's a reliance in
Mm-hmm.
that. I like that. I really like how we're moving the 3 C's into mentorship. As our time goes by always so fast, I want to talk through something
All right.
with you. Because at the recording of this show, a man walked into a Jacksonville grocery store and gunned down 3 people.
Mm.
And I don't often get to talk about that anymore. I don't often, I don't know if there's a numbness to it or it didn't happen to me, so there's an escapism that comes with this. Like, but we're just seeing more violence in our country, and the fact that on any given day you can die at the hands of someone else, and particularly as a man of color, as a black man, the heightened level or the heightened, no matter the station of our lives, we're two very, very successful people. But at the heightened station of our lives, we still could be in a grocery store and someone come in with hate and take our lives. How are you internalizing all the things? How are how are you internalizing that and still finding joy in your life?
It's, that's a deep question, particularly because in thoughts and prayers, and I'm continuing to keep the Jacksonville community in my prayers. Is my pastor, who is a mentor to me. Uh, that's where he's from,
Mm,
and on Sunday he spoke about it as um, strongly as he could,
yeah.
but I could still see that it was painful. No matter how we articulate it and what we do, it's one of those things where I don't think, the optimist in me says that we still have to continue to try to change what people think the narrative is.
Mm,
Because I think the vast majority, and I know the vast majority of people are good, right? It's unfortunate that we choose, and there has been just tons more violent crimes, shootings and various things, but I think that is still, I still have to believe that that is the minority. And I think the more we do things like in this conversation where we talk about expanding our circle, helping people to understand, and realizing that racial ideas, and sexist ideas and gender-based ideas that would force someone to polarize themselves against what the norm is, because the norm is good, the norm is acceptance, the norm
mm,
is all these things, and you have this one individual. And so I think it's up to us to articulate that no, that's not normal, that's not,
yeah.
hate
Mm,
is hate is a learned behavior. I mean, and we can look back at multiple studies. When you put two babies that look totally different, they're gonna play together. When you put two
right.
kids that's totally different, and that's from a psychological, and I'd love to hear your perspective on that.
Mm,
But once you insert I'm better, or those people aren't good, or those people are evil, well, now it changes how that interaction occurs. And
yes.
I think
Yes.
it's gonna sound crazy, even though that there's a rift, this isn't the time to build fences. This is the time to build bridges,
To
right?
build
To
bridges.
to reach across this chasm, or these seas of trouble that come about. This is the time to reach across and walk across, and engage in such a way that people know that we're all in this together, right? Because I think that black, white, whatever, someone walking around brandishing a gun and doing that makes everyone feel uncomfortable. But at the same time, we have to have these difficult conversations. We have to.
Yeah. Look, and I know that you are a super fan of the show, and I just want to give a shout out to my dear friend Mohammed Leela, the CEO of Goodable. And it's interesting that you bring up like the statement that he said is the question that we asked is that are we more good than bad
Hmm.
as a populace? are there more good people in the world than bad people? And that's the question that I think that we have to continually ask, you know, because we can internalize what we imbibe so much.
Mm-hmm.
And I know that, Wayne and I even talked about this on the show, is that when we see these things, when we internalize Dylan Roof walking into this, South Carolina church and murdering 9 people, when we see what happened in Pittsburgh, when we see what happened in Jacksonville, when we see like the litany of the historical nature of the murdering of Black folks, right? From the time that we were brought to this country, the murdering of Black people. If we continually internalize that, we both know, as a psychologist and a cardiologist, the imprinting of that malice is encoded into our DNA. It is then epigenetically passed down. It continues. And so to break these chains, we must understand that the answer to this question is to hope that more people are good than bad. And that can we walk into rooms with that sense of there are more people in this room that are good than bad. And that if I encourage, or not encourage, but if I am entangled with a bad person, I know that I still have 100% responsibility to choose how I react to that person or those people. And so that is the interesting thing, because it is hard. It is hard, Governor DeSantis, to think about vacationing in Florida and think about the whitewashing of my history, of our history. It is
Speak on
very,
it.
very hard.
Speak on it.
But to understand that the greatness, the historical litany of people that have risen up, that have created legacies and nations and tools that allow us to live each day, I must think about that to almost keep my sanity, right? You think about that, to almost keep my sanity, to understand that my people are people that more folks that the Ryan O'Mearas of the world, the James Harrises of the world, the Kevin Keels of the world, right? These are 3 of my good white male friends that love on me and I love on them, that I know when I think about it, the goodness that happens in the world, I can look at them and say, there's some good over there,
Mm-hmm.
And I think that's what you're saying, that it brings us joy to know that if I ask the question, is there more good in the world? Yes. There are more good in the world than that man that walked into that Jacksonville store and took those 3 people's lives and took his life. There are more good people, and I'm going to hope that we can galvanize together. And I will get off this soapbox, but yeah, that's it. That's it. Yeah.
Necessary.
Yeah. Look, let's park this bus. Let's park this bus. Dr. Travis Batts, look, look, if you saw my calendar today, I had 5 meetings before this, but it is the joy of my day. And I got to look in 5 meetings before this. I got to mentor Black women entrepreneurs, and work with them and be with them. I got to sit with my new CEO and build and see what trust looks like. This is still the highlight of my day.
Oh man,
being here doing this Revolt and Evolve with you. Episode 6 of as we continue to go.
Man.
But as always, take us out.
So first off, thank you for being the highlight of my day as well. Tuesdays, as you know, are my days where I'm in clinic, out of clinic, in meetings, back in clinic. I didn't get to do my meditation, but I kept my mind on an opportunity to talk and to just get stuff off my chest. And again, we have fun,
Yeah.
and what I would encourage everyone to do is to find somebody just to talk to, right? Whether it's your barber, whether it's your hairstylist, whether it's your lash lady, I don't know. Whoever you need to talk to get stuff out, that social connectedness that we know is key to longevity. Find that opportunity. And as you're working through things, I mean, and our conversation today was like a roller coaster. We talked and we gave
Mhm.
you some structure, we gave you some medical knowledge and nuggets, and then we talked about kind of the social justice piece, not to mention
Yeah.
our role of advocacy. And when we transition that role of advocacy into issues such as social justice, again, you can't wait for things to happen around you. You have to be a part of your community so that you can truly make change within your community. As Dr. Corprew said, we know that the world is intrinsically good. There are more good than bad. But if the good never open their mouth to let anyone else know,
Mm.
nothing will change.
Nothing
Remember,
works.
the difference between a moment and a movement is sacrifice. So make that move, make a difference, and help things move forward.
Yep. And make that change. And make that.
Great time, brother.
Man, look, revolutionaries, like, this is what you get. Like, this is what you get. Like, I want you to, we're going to clip that up. We're going to clip that up, what you just said, right? Clip that soundbite up, right? Like, what he just said is just why we have Dr. Bass on the show. So he loves you. I love you. We will be here with you next time. We are looking forward to next summer because literally I never want summer to end. Um, but we'll see you next time. We'll see you next time. And Dr. Bass and I both wish you the best in answering what we think is the most thought-provoking question of your life. What's your revolution? We'll talk to you soon, everybody. Peace.
Peace.